This is Dr. Bramlett, and first disclaimer is I'm a pediatric cardiologist, not as well versed in some of the more detailed nuance of coronary artery anatomy, but for the purposes of our segmentation and scoring system, I wanted to review, and I was going to wait until I pulled up a decent example, and right out of the gate I pull up a decent example here. This is this patient has a central shunt VSD. It's a pretty good coronary artery example for the presumed size of being a infant. And so what we have on the left here is our axial coronary anatomy, and this is the CCT official diagram. And the way I've designed it is these blue circles here represent the ostia of the right coronary artery and left coronary artery. And those are represented in blue here. They're essentially four groupings, but it's this is sort of just the baseline. And then we have the green, yellow, and red. And green is essentially like what is considered the must-haves to pass, and those are represented by the segments 5, 6, 7, and 1. 5, 6, 7, and 1 is up here, right coronary artery. And then the yellows, we have the right middle segment, and then the right distal segment. And then this is where it wraps around to get the posterior descending artery. That's the PDA. The reason why there's a left and a right is this is sort of patient dependent, which as it goes around the inferior side of the heart, which it could be right dominant, which is usual, or left dominant, meaning the circumflex could come around and supply a vessel down here. And so that's this. And then for the left main, it's essentially this little segment before we get to the bifurcation between the circumflex and the diagonal, or I'm sorry, and the LAD. So this is LAD here, and this is the circumflex here. And these are so what we're going to go through is sort of what we see here, how they relate to actually this here. So let's start with the left main, which as I come up, we'll see is here. So the left main is here. It's going to branch into the LAD and the circumflex here. So let's kind of knock out all of the green, because this is going to be the first thing that we're going to see. So yes, here's the left main, and it's going to go down. And so the very first proximal segment here is 6, which is to the first branch, which is a diagonal, which would be here. So here's the first segment here. So this is the medial portion, and then the distal portion. So I'm going to skip around. Sorry. We're going to actually cover the rest of the LAD. So distal LAD is here essentially to the apex. And so, I'm sorry. First branch, the proximal is to this first diagonal coming off. And then the medial portion is from the first branch to the essentially half the distance to the apex. And we're just eyeballing this. And so we could definitely see this better in probably a coronal plane, but I'll show you where I'm not really too concerned about that. And if in the document, if you want like actual, second diagonal and like where everything actually is, feel free to go down in that document later. But again, if this is the apex and we're coming up about halfway up, so if this is to the first diagonal here to first branch, and then the second is to half the distance to apex, we're just saying somewhere around here, right? I can go down here, so it's going to be somewhere around here. And again, if I'll show you why I'm not too concerned about looking at grading that off of this right here. So that's the LAD. So now let's do the right coronary artery. So the right coronary artery originates here. We have a conal branch, but we're not concerning ourselves with that. And just like we're not concerning ourselves with the ramus, we're going to come down here. And so what is the proximal? What is this green section here? To half the distance to the acute margin. So I looked up this description of acute margin, just so it's a sharp inferior edge of the heart's right border formed mainly by the right ventricle where the anterior and inferior, so it's where the anterior surface of the heart comes down and meets where it sits flat on the diaphragm. I liked the way that was described. Let me pull this back up, these back up. And so the proximal is to half of the distance to the acute margin. And so as I scroll down, I'm just going to scroll from liver up, and I'm coming over. So there's the right coronary artery origin, and I'm going to steadily go down, and then see where it's curving around the edge right about there. Again, if we showed the axial slice, I'm sorry, if we showed a sagittal here. So again, let me go to the right side. This is acute, and then this is obtuse margin. So again, right ventricle diaphragm is the acute margin. And again, it's not sitting exactly in there. But again, I'm not too concerned about that. The whole point is to show how it kind of goes around that corner. And so if I'm saying halfway to where it makes that corner, so I think it's sitting right here on that acute margin. And so halfway, if we say here's all the way up, we're just going to say halfway. And again, I'm not too concerned about some of the specifics as seen in here. But we can see the left main, we can see the proximal LAD and medial LAD, as well as the proximal RCA. Those are, I think, the main things you really just kind of have to see if you can see on this image. But let's finish out some of the others. So and then if this was halfway, then to here would be the this section here to acute margin 3 is then from that angle where it came around, and it's going to come back under the heart. And when it gets here, it's going to send off a posterior descending artery here, which let's see if I think I could. Yeah, I think there's a good chance this is it here. Again, this is an infant, so we're doing pretty good to see what we're seeing. So it's from the corner as it wraps around the bottom. So this posterior descending is back down into the red category of wants but not needs for our grading system. So that's the right coronary. Now let's do the circumflex. So again, left main here, and we have the LAD and then the circumflex. The circumflex, while the LAD goes interventricular groove, so this is the left ventricle and right ventricle, provided there's not ventricular inversion, which looks like it's not. The big AST, in case you, or sorry, VSD. So this is between the interventricular groove. The circumflex right here is riding between the atrioventricular groove. So where the sort of the mitral valve annulus, and it wraps around. And it also, if it was a left dominant system, we would see it wrap back down here and then supply that posterior descending. But I don't believe that is the case on this. But again, this is an infant. And so as we come up here, what is our definition of the proximal, the proximal left circumflex from bifurcation to half to 2/3 to that posterior AV groove. So if we're trying to get around to this groove back over here, like it's got to work its way from the aorta all the way back to the mitral valve AV groove, and this is posterior back here. But you'll also notice that it goes essentially to the obtuse marginal one. And as you can see here, there is a nice vessel coming off here, going to the acute margin over here, obtuse margin over there. And so this would be around here is half the distance to posterior, which is like once it gets to posterior here. So, and again, that's not too much of a concern. And then, so really the only green, like the circumflex isn't even considered in the main passing component for autoseg. So it's and a lot of that's based off of, it's showing up on this because there's probably not much fat around it, which can sort of mask it in the adult cases. And so you can see it bifurcates, and then there are all kinds of different variants, and different coronary arteries can have different levels of dominance towards the watershed regions. So anything else beyond that is going to be considered the red. Now, this is just sort of a cursory first look at the axial, but the reason I was saying that I didn't care too much about that is because, and so if we, so what we just did was the possible. So we definitely have, so what we have as based off of what we looked at, we have the all of the green, and we even had the we had it all the way, we had the right all the way around here, so we had all the yellow. We had the circumflex that went, we could see it a little past that region, but not much, and we could see it all the way down to the apex here. So we definitely had all of this. And then the question is, did we have any red? So we can't, so that this would be a 1. This would be, you know, if we have all of the green and blue, then that's going to give us a max of 5, so 50%. And each one of these counts for an additional 1. And so that's 9. And then if we have anything else beyond here, we would call that a 10. And I think there's definitely cutoff. We don't see we can see it sort of as it comes back in view, but we lose it right here where it's right around this region here. And the circumflex, we do see an obtuse marginal. I think with that, we could call it, I think we call this an actual perfect 10 for purposes of scoring. But the thing I was going to point out is, so if this is the anterior portion, if I move that P to the back, see the posterior, if I move that to the back where I've got my square, then that gives you a good sense of how we're looking at this anteriorly. The right coronary artery comes off anteriorly. And so here is that acute margin right here. And we can actually see that coronary artery that is coming around here. So the question is, I don't think I would count where it is blended in. I think this would be a fail, and we lose it here. So that means for the right coronary artery, I'm getting it to, let's see, what's the difference, to half the distance to the acute margin. I would say we are going to about half the distance to the acute margin. So, yay, we have 1. But we don't have, because of the gap that is in here, we do not have all the way to the acute margin. So this would be, this is segment 2 from here to here, which is here. So 1 comes down to about half the distance, 2 to the acute margin, 3, it comes underneath. And so remember how I said there was a posterior descending? So this comes around, and then the posterior descending runs down here in the interventricular groove on the inferior side of the heart. And so this is, again, because of this is not a complete, but that's definitely the coronary artery that it's tracking. It is going to, so we also have the segment 3 here, which is 2 PDA. Again, we're not going to say it, but I'm just pointing out where that is. And so the point being, when I'm looking at the 3D, it is much easier for me to grade the actual than the potential. So on the right, we only have this because it goes down to the halfway point here. So now, what are the components of the other? So that's going to beg the question, what about this spot here? Anyway, let's start here. Left main is up on here because we can see it then branches into the LAD. The left anterior descending, right? So now if I come back out, I've got that P in the back. You can see how I'm like squarely in front. And as that branch comes over, see how this is going to come down anterior? It's the left anterior descending is going to come and go down between, do the interventricular groove. And then the circumflex is going to go around here. So what do we say to the proximal LAD is to the first branch, which we could see that better before, which is actually not too, the distance is not too long. And then the medial LAD is to half the distance to the apex, which I think this is, I am fine to fudge. If we're getting out and we're coming around like this, I think anywhere in here for our purposes, we're not going to say exactly to half inch. We're looking for, did it do pretty good? So I would say this is okay. This is okay. I don't like how this is fused. And then this spot here, I'm okay with this because it is more just sort of and again, we're in a pediatric patient. The adults with larger hearts are not going to have this big of a problem. And there's pulmonary atresia here. That's why the stented central shunt is present. So we're saying that I'm going to agree that it is, including segment 7, half the distance to apex, yes. So currently we have yes, 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 yes. So from this standpoint, it is a pass because we've gotten all this. And if any of these had not been not present, then it would have been a fail first, and we would not have bothered grading beyond this because you have to complete a group before you can score the next group. And so now, since we've completed that, then I want to say what's going on. So we know that the yellow here is to the acute margin. We don't have half to acute, so it's not, the right's not going to get it for us. But we certainly have at least the proximal circumflex from the bifurcation to 1/2 to 2/3 to the posterior AV groove. And so we were able to see that obtuse marginal very well on the axial. So my guess is that this is, without seeing that this is, because it doesn't take too much, this is not a long distance. My guess is we're going to score this with the proximal left circumflex, but not the distal LAD, not the medial or distal right coronary artery. So I think this is going to score a 60 for actual with a potential of 100 or 6 and a 10. So let's go back and let's confirm. Last thing we're going to do is we're going to look at these. Let's first look at that circumflex because that's part of the scoring system. And so here's the branch. You can see how it's going down here. And again, this is where it's sort of cutting out. And that corresponds to this point on that. But the left circumflex comes down, and then this is a circumflex because it's going around to that posterior AV groove. And then this is that obtuse marginal. So it is all the way to that bifurcation. So yes, so this indeed is a 60. And then one last thing, let's park this in the garage. Here's that right coronary artery coming around, and then we said that it stops about right here, which there it goes. It disappears right here. It tapers off, right, which is about halfway to that making its turn. And then once it makes the turn, it comes back. And this is where it's fused together. So all of this is fused together with the atria, which is what we don't like. And there's some fusion here. And then and we looked at the LAD, right? So here's the left main, here's the LAD, and circumflex. So that's a quick rundown of how I would score this heart, which I think is an excellent example. Kind of got lucky on the first one we're looking at. Thank you.